Hello everyone, we are live. This is my first ever live. I wanted to do kind of a casual chit chat, Q&A, ask me anything while I get ready for bed. So, first off, this is medical advice. However, it is not personalized medical advice for you. So while my information I provide today is given by a licensed medical provider, remember, talk to your own medical provider to make sure that this advice applies to you. So, first question I often get asked is, what is a midwife? And that is a great question. A midwife, at least in my jurisdiction, is a primary care provider, meaning that they are the main healthcare provider responsible for your care, or MRP, most responsible provider. And their role is to provide all of the care that you require while you are pregnant, while you give birth, and while you are for 6 weeks postpartum in my jurisdiction. And so what a midwife does is they order your blood work and your ultrasounds, have conversations with you about upcoming tests, do all your prenatal checkups. We're with you during your labor and your birth, and then we care for you and your baby until 6 weeks postpartum. And that involves breastfeeding support. In my case, I am a international board certified lactation consultant, IBCLC. And so I also provide high quality breastfeeding support to my families that I work with and families from all across my area. So that is a midwife. Well, let's see what other questions I have. What is the difference between a midwife and a doula? The easiest and most simple way to know the difference between a midwife and a doula. Thanks for joining me. So non-medical labor support, meaning they're not doing your medical checkups, they're not performing your bump check or listening to your baby's heart or ordering any blood work for you. So a doula is there to provide hands-on comfort during labor to help your other birth team people, whether or not it's your partner or your friend who's at your birth with you. Their job is to make sure that everybody's integrating as a team for your comfort. Whereas my job is to make sure I am getting the documentation done and I am there to look after your baby and handle emergencies. So that is the difference between a midwife and a doula. Doulas are an incredible part of a birth team, no matter who your care provider is, whether or not you have a doctor or an OBGYN or a midwife. And then we also are there to integrate everybody together as a team. So yes, midwives are very different than doulas, but we do still work closely together. So, other questions that I get are, do babies really come on full moons? And I've got to tell you, there is something to that theory. The number of times that I have been at births during a full moon is kind of extraordinary, if I'm honest. My theory is that there's something to do with the shift in gravity around that time that essentially changes something. Truthfully, we don't actually know what triggers labor to start. And so, is it that slight gravitational change that triggers it? Is it that moms believe that their babies will come on the full moon? That's also possible. And something about it changes and babies go out with the full moon. I don't know, maybe they want to meet the full moon. What do you think? Leave in the comments below. Why do you think babies are born more frequently on the full moon? I'd love to hear your theories. And please, if you have any questions about pregnancy, birth, postpartum, breastfeeding, I want to know what you want to know. I'm here tonight to answer your questions because I know it can be really challenging to get quality information. So please hit them up in the comment below, and then I will answer your questions. Ooh, pregnancy cravings. So pregnancy cravings is a really interesting one. And some of them are actually based in science. So one of the pregnancy cravings that we sometimes see people have is eating dirt. Clay, dirt, soil. Hi guys, thanks for joining in. Nice to see you. Sometimes these pregnant women will crave eating dirt, and they find it super strange because it doesn't exactly sound safe, and truthfully, it's not safe for people to eat dirt. And so what this can actually mean is that women are deficient in iron. And essentially, their body is telling them to eat dirt to improve their iron status. Pretty weird, right? Okay, question from Buttery Bao. Ooh, bao is delicious. Pregnancy isn't as hard as people say it is. Is it? So honestly, pregnancies are so individualized and so different. And honestly, somebody can have one type of pregnancy, and then another time, the next baby, they can have a completely different pregnancy. And so for some people, pregnancy is really rough. Nausea in the first trimester, aches and pains in the second trimester, persistent nausea, still feeling sick, throwing up every day in the second trimester, and in the third trimester, just feeling really sore and uncomfortable and dealing with other complications that can arise medically. Other people don't know they're pregnant until 30 weeks. You would be surprised the number of people that I have come into my care who have no idea they're pregnant until 20, 25 weeks because they didn't have symptoms. They didn't realize that the discomforts they were feeling were pregnancy because they were so mild. And I am a huge believer in that mindset greatly influences your experience. How you choose to perceive something is a big piece of the experience that you'll have. And so, yeah, it's absolutely a blessing and a curse. Pregnancy, you get the good and the bad with pregnancy, and you kind of are dealt a deck of cards and they're going to be what they are. But how you perceive those things that are happening to you greatly influence what they actually are. And so it really is about perspective, and we can see families with really hard pregnancies and they're maybe very grateful for the fact that they're finally pregnant after years and years of trying. And those people, they aren't thinking that nausea is too bad. And so really, is pregnancy hard? It really is individualized, and it really depends on your perspective. All right, shoot more comments and questions below. I love that you guys are sending me them. I'll keep answering them as they come up. Raccoonpedia says, as a man, I could never be pregnant. A fever gets me laying down like a cadaver. Yeah, for anybody who doesn't know, a cadaver is a dead body, a person who's donated their body to medical science, and they are flat out. They are done. So I hear you, a fever, yeah. But you know what? Like, some pregnancies are easy. Like my own pregnancy with my own kiddo, I was fine for my first trimester. I was nauseous. It took work to manage it. A bagel at 3 a.m. was my savior. And so then essentially, I was able to kind of get things going. But kudos to you for recognizing that pregnancy can be a difficult experience. Am I related to Rebel Wilson? That's funny. I've never got that one. Years ago, I used to get, are you Taylor Swift? Especially when Taylor Swift had her wavy hair era. Who else did I used to get as celebrity doppelgangers? But it's been a while. Rebel Wilson. Is it the hair? Is it the eyes? What is it that's giving you Rebel Wilson vibes? Okay, more baby questions. So baby questions. And one that I often get asked is, what's one thing that parents worry too much about? Parents have a lot of worries, especially if it's your first baby. People have a lot of worries, and fair. You want to be a good parent. Absolutely, we get it. But one thing that I think people worry about too much is actually their baby's skin. People are often really freaked out about what's happening with their baby skin, and most of the time they're normal changes. For example, it's very common that for babies who are well cooked, those who are past their due date when they're born, by about day 3 through 5, they actually get really dry skin. Often it's in like the cracks of the wrists or the folds where the feet are. And so those babies, their skin can get really dry, and essentially wherever their joint is moving, they'll get a crack. This is actually pretty normal. Of course, we don't want the skin to split, so I often recommend applying a very gentle moisturizer, something that has no fragrance, or even better, coconut oil or olive oil. Where are you from? I'm from Canada. Can you tell by my accent? Where would you have guessed I was from based on my accent? I have a very, I think, neutral accent or West Coast accent. I don't know. Where do you think I'm from? Raccoonpedia asked, is it true that it is easier on the mom during the middle of pregnancy than the start and the end? Yes, this is a great question, and it's true. Most people will find that the second trimester, so we define second trimester usually as 14 to 28 weeks, that window there is often a reprieve from a lot of symptoms. So for a lot of moms at that point, their nausea's getting better, they don't have the aches and pains, often their energy levels are improved. At 14 weeks in the second trimester, often they're not having headaches anymore. And so a lot of people call the second trimester the honeymoon phase. And so that honeymoon phase is often when a lot of people will plan for like travel, or towards the end of it, photos. And essentially it is really kind of a sweet spot for a lot of people in their pregnancies, that second trimester. And a lot of people really appreciate feeling like themselves again after coming out of first trimester. That first 14 weeks of pregnancy is really variable. Alberta, awesome. Those red license plates. Okay, more questions from my list of stuff. How long do people bleed for postpartum? This is one that people often are surprised by. And obviously, when you're pregnant, you grow this big old human, but there's a secret organ that supports that big old human while they're growing, and that's called the placenta. The placenta at term is about the size of my hand, or often described like a small dinner plate. And that placenta interacts with the uterus at the microcellular level to stick deeply into the uterine muscle. And so when that endometrium and the myometrium is there, sorry, I should say more clearly, not the muscle, it's called the endometrium. The endometrium, it sticks there. And when you give birth, out that placenta comes, but now you have this dinner-sized wound inside your uterus. And so all of this endometrium is now open blood vessels. After you give birth, that uterus contracts down, contracts down, contracts down. It's one of the most important things we make sure of postpartum. Immediately after you have your baby, that tight contracted uterus is critically important to preventing a bleed. About 70% of postpartum hemorrhages or bleeding after birth are actually caused by that uterus starting to let go and that dinner plate size wound starting to bleed. And so that wound can stay contracted down and stop bleeding if we're relaxed, if we're calm, if there's no unpredicted reason why the uterus would start to relax. But that wound takes time to heal. I often say to people, imagine if you had a wound that size on your chest or a wound that size on your body. It takes, Raccoonpedia is asking, it takes about 6 weeks. And so it's very normal for people to have heavier bleeding in the first 1 to 2 weeks postpartum, often described like a heavy menstrual flow, and then getting lighter day in day. Many people will notice that bleeding is pretty much gone. It goes from red to pink to white, and then eventually nothing, sometime between 4 and 6 weeks, but definitely within the realm of normal to have some bleeding still at 6 weeks. Sometimes you get little fits and spurts where you're like, I think I'm done, yay, and then you have another little bit of bleeding. So that bleeding postpartum it really does last longer. People are often like, oh, 3 days of bleeding, like a period. No, no, no. We are talking weeks. Weeks is what's normal. And so it's one of those things that, the body takes time to heal. That whole 9 months in, 9 months out, well, a piece of that is that placenta you grew. So it takes time. Keep putting questions below. I'm loving seeing them. It's great to hear what you're wondering about. More questions. How do I help someone stay calm during labor? This is a great question. I'm so glad that someone had sent it in. Staying calm during labor is really challenging because generally people are experiencing sensation, and I use the word sensation because not all of labor can be described as pain, but a sensation that they haven't done before. And there's an intensity there for sure. And of course, a lot of people would describe some of those sensations as painful. Absolutely, not debating that. And so how to help someone stay calm. A lot of staying calm in labor is about using your breath. When everything else is changing, maybe your nurse needs to take your blood pressure, you can't move in that moment, you can't use whatever hip squeeze that was helping you through, you always have your breath. And so when I'm working with someone, especially when I start to see in labor that they're starting to spiral and they're starting to panic and they're losing control over what their own experience is, we can bring a lot of that back to the breathing. Because when we anchor with our breath, it actually regulates our nervous system. And sometimes I'll do that by actually describing to people what I want them to do with their breathing. And sometimes I will actually demonstrate that breathing technique and say, do this with me. The other thing that I'll do is I'll describe to people what I'm seeing, because I feel like a lot of people in labor, especially when they start to get to that panic cycle, they aren't necessarily actively processing with a cognitive brain what's happening to them. They've gone into that panic state. And so by describing what I'm seeing, hey, I see that you're no longer using that breathing we talked about earlier. Can you take a moment and feel what's happening in your feet? Yeah, absolutely. Talking to the person, it makes a huge difference because I think it triggers the brain to snap out of whatever negative cycle that they were getting into, to re-regulate themselves back to where they can use the techniques that were working for them. And so it's amazing how much having someone talk someone off the wall can make a huge difference for all of a sudden their pain scores. Like they can be reporting a 10 out of 10 pain. They're in the worst pain of their life. And then all of a sudden, yeah, you know what? They're doing okay. They can do that position change we talked about. They can go through that next step. And it makes a big difference. And so it's one of the roles that often a doula will fulfill, nurses, and we never were meant to birth alone. We always were meant to birth in these communities. And so having someone to talk you out of that space and coming back into a space that's productive for you is an amazing tool. Ooh, baby belly buttons. This is one that also parents will message and call and be concerned about all the time. And the truth about the belly button, for those who don't know, is the belly button, or sometimes called umbilicus in some situations, is actually the spot where the umbilical cord attached to from the placenta into the baby. So your belly button is where the placenta attached to baby, so that umbilical cord spot. And that tissue needs to no longer be attached to your baby at some point. And the process of doing that is essentially a form of rotting, and a really normal form of rotting. Essentially, not long after birth, because there's no longer blood flow, those vessels start to close up and kind of atrophy is the medical term we use. And that atrophy, as it happens, essentially there's no longer blood being supplied to the tissue in the umbilical cord. And it's also now from a water-based environment, the amniotic fluid that was around baby, into a dry environment. And so what happens after birth is we, if possible, we wait till the cord stops pulsing. We cut that cord. We often place a little plastic clamp close to baby, and then we wait. And the goal is to leave it alone as much as possible. But in that waiting process of day 3, 4, 5, where it gets against baby's skin starts to get pretty stinky and pretty gross. And so essentially it starts to rot off, and then it can kind of get pretty goopy. So one of the things that I do is I actually go and I very gently separate the skin that's kind of sticking to the base of the cord off, and then it gets more air, and that kind of rotting off process of the umbilical cord can happen, and then that stump falls off usually by a week. And that's a really normal process, but it grosses a lot of parents out, and it is gross. It's goopy in there. Sometimes it bleeds a bit, but it's totally normal. All mammals have this process. Another question from Raccoonpedia. Around what time would you advise circumcision? So circumcision is obviously a very contentious topic. Here in Canada, it's considered a cosmetic procedure, so it's not funded by our healthcare system. In many communities, the recommendation time is to do it within the first 2 weeks of life. And so that after 2 weeks of life, it's often needed to be done by a specialist, often by a urologist, just because the procedure can be a little bit more complex. And so, yeah, before 2 weeks of age, often I see them scheduled between 1 and 2 weeks of age. And there's often really good follow-up that happens with them by the docs who do them. We can give infants Tylenol as soon as they're born. They can have Tylenol, so babies can have good pain relief from it. Another question that I commonly get about pregnancy is about nosebleeds. You'd be surprised about the number of people that will call my office and say, I've had a nosebleed. I've had 3 nosebleeds this week. Is this normal? And it actually is. I get why people would be concerned, especially because they can be quite heavy, but it's actually a really reassuring sign that essentially the blood vessels in the nose have been influenced by the pregnancy hormone progesterone. And progesterone means pro, meaning for, gest, meaning pregnancy. So it's a good hormone to have circulating in your body because it's helping the uterus essentially to stay quiet. And what happens is all those blood vessels in your nose are now larger and more plump, but also more fragile. And so if it's common changes that we see that trigger nosebleed, allergens, dryness, even just like changes in like environment can make a difference. And so yeah, we see a lot of nosebleeds in pregnancy, and it's a funny one, and it sucks because often people are quite taken aback by it, but very, very normal in pregnancy. Are midwives just for crunchy people? Certainly, I feel like in some communities this is still the case. In some states this is still the case. Where I am in Canada, many provinces, midwives are fully regulated healthcare providers who essentially provide care to all people. And now I think in most areas in Canada, we have all people who come for midwifery care. And essentially they're looking for care that is customized, is individualized, and often they want the home-based care from a primary care provider. So that home-based care support is another reason why people will seek out midwives. And you don't have to be a crunchy person. You don't have to give birth at home. You don't have to not take medicine. You don't have to ultrasound. We want you to do the things that already are happening for everybody else in pregnancy and be supported in the choices that you're making. So going back to the nosebleeds, is that the reason why sometimes the nose grows a little larger during pregnancies? So the nose growing larger in pregnancies, that's a good one. I think probably most of that is actually swelling that happens in pregnancy. So again, a lot of those hormones and the changes in blood flow with pregnancy are going to be relating to the fact that essentially face shape changes and also those hormones. So but swelling is a big piece, because a lot of those people, especially some women, get a very round full face in pregnancy, and what you'll see is like a widening of the bridge of the nose, and essentially when there's fullness here, it makes the nose look larger. And so I think it's mostly relating to the swelling that comes with pregnancy because of those hormones, not necessarily the actual structures of the nose changing, but more so the hormonal swelling that many women get. And it is amazing how much people's faces can change in pregnancy. Some people are people who you can't tell that they're pregnant from the nipples down, and other people, their face is just so radically different. And it even changes quite dramatically in that first week postpartum. Again, a lot of women will have night sweats in the first week postpartum. They'll find like they'll wake up and like they're needing to sleep with a towel because they're just sweating out so much of that swelling, or also they're peeing a ton because they're processing out all of that swelling. And so yeah, very common to have night sweats postpartum, and then therefore we see feet and faces and ankles all change very quickly postpartum, and that's a reassuring sign. My mamas who are more swollen postpartum, I'm more worried about them for things like having high blood pressure. Essentially, that edema should be coming out. You shouldn't be super swollen postpartum. That is not a good sign. Yeah, so that's a great question to ask, and a long explanation as to how, if that's how your nose swells. Awesome. I'm just having a look to see if there's other questions. Great. Ooh, how do you hold a newborn without looking terrified? I just did a video on this. It's my most recent published long format video about how to confidently hold a newborn. And I don't have my baby with me because I'm getting ready for bed. But the key piece with making sure that you are feeling confident in holding a newborn is about supporting their head. And I know most people know that, but you're not necessarily told how to do it. And so the right way to hold a newborn's head is to think about putting your thumb and your pointer finger behind baby's ears. So essentially you'd be putting your thumb and your finger on these little spots right here. So thumb and finger gives you that stability, and then often I describe knuckles or the heel of the hand, depending on the size of your hand, is where you support the back of the neck and the shoulders. Once you've got that piece done and you have another way to stabilize your baby, that baby is going to stay super stable because you're supporting their head and neck. Doesn't really matter what the rest of their body is doing. And now you have another hand to support them. But that allows you to avoid the kind of like putting the arm behind the neck and the neck's all rolling awkwardly. By having a hand at the back of the neck, that really makes sure that you can get that baby nice and snug and secure and stable. Somebody asked me this and I thought it was pretty funny. Can you actually sneeze a baby out? No, I've never seen anybody sneeze a baby out. That would be an interesting birth to be at. I understand the question. Often at the end of pregnancy, things feel weird. Many moms, particularly not having their first baby, will feel like their baby's gonna fall out at any minute. And truthfully, sometimes there are women who are at term, so 37 or more weeks, walking around multiple centimeters dilated. Very common to be 3, 4 or more centimeters dilated. Most of the time we're under 4 centimeters dilated, and that baby is sitting low in the pelvis. And it feels like if you sneeze, that baby's gonna come down. And so in some ways that sneezing mechanism is what's pushing baby onto the pelvic floor. But have I actually ever seen anybody sneeze their baby out? No, I haven't. Maybe that's one I should put on my career bucket list before I retire. This is a great question. This was essentially where I was gonna go next as well. How long before guests can be allowed in the home to see the newborn? So I am pretty relaxed during pregnancy about what you want to do and how you want to be in the world and what care you want to receive, as long as you have all the information that you need to make an informed decision about the care you want to receive. When it comes to postpartum, I'm pretty strict. I think firm guidelines really help people to ensure that they are able to recover and they're keeping their baby safe. So generally my rule is postpartum, you can have guests over. Of course, there's family members who want to meet your baby, but I have two really strict rules. At least in the first 3 days, they need to be people that you know and you trust enough that you can be sitting all snug in your bed, holding your baby, and coming to visit you in your bedroom. If they are not visiting bedroom folk, they do not need to be in your house yet. That first 3 days is so important for mom's recovery, for baby to get going, to be building their immune system from breast milk, and to be not overly disturbed. This is not the time for your neighbor down the street to come snuggle your baby. It's not the time for your auntie from Wichita to come and bring you all her friends. First 3 days, definitely lock down. Then my second rule is they have to be people who can respect the don't kiss the baby rule. The don't kiss the baby rule is a non-negotiable. One of the things we worry about with newborns is a virus called RSV. And RSV for most adults is a common cold. We aren't that worried about it. We wouldn't even know we have RSV during cold and flu season. But for infants, because they're immature in their immune system, they don't also have a good cough reflex yet, they are more likely to get very sick from having RSV. So 2 rules. First week of life, absolutely, they have to be bedroom visitors, people you are comfortable having in your room. And 2, they need to respect the no kissing and hand washing rule. That's what I think as the kind of the guideline for how long before guests can be allowed in the home to see a newborn. So your most inner circle in the first week. After the first week, you can start introducing more people, but they need to be people who will follow the 2 rules. And you can always tell them, I saw this midwife online. She said nobody's allowed to kiss the baby. You must wash your hands. And the hand washing rule I keep for the first year of life, because many babies, they don't get their full vaccine series until they're a year old. And so those babies, they don't have the full immune protection yet until they're a year. And so I think parents can feel really justified in supporting clear boundaries about protecting their infants from getting sick. The other one would be, don't be afraid, especially through cold and flu season, to say to people, how are you feeling today before you come over? Does your toddler have any symptoms of a virus? You can reschedule that visit for another time. If you absolutely have to have those people in your home or go to their home, be firm about saying, can you not snuggle with baby closely? Do you mind wearing a mask? And do you mind washing your hands? Those simple precautions can make a big deal, but obviously distance and not exposing your infant to those things are the most effective. Have I ever cried at a birth? Oh my goodness. Yes, I have cried at births. Sometimes because I'm tired, but a lot of the times it is the coolest thing. There's nothing cooler in the entire world, and I will debate it with you, than meeting your baby. And it is such an incredible gift and privilege to be with families when they meet their family members. And so sometimes the reaction that mom and dads have to meeting their little humans is just so genuine that, yeah, I tear up too. Being a part of families' birthing experiences, I don't take lightly. I think it's a very special time that they've essentially, whether or not they invited me or I was there because I was the person going to be there, it's so special to be a part of, and I will never take that for granted. And I don't think birth will ever stop being magical. Ooh, great question about formula usage. So what brand of formula or kind do you advise as compensation for breast milk? Great question. Ultimately, the right formula is the one that A, you feel good about using, B, you can access reliably, and C, your baby tolerates well. So yes, it's true. Sometimes babies will tolerate some formulas better than others. It's always best to start baby on a generic formula, so not one that's soy or hydrolyzed or even down to the aminos, because we want to make sure those things are always available for babies who need them medically, but also because your baby probably doesn't need that premium cost. And so it really depends on what you want to achieve with formula. In Canada, there's certain brands that we now have coming over from Europe that maybe potentially have cleaner ingredients than those manufactured or produced by companies such as the big giants. And so those, sometimes if parents prefer those ingredients, then absolutely those European formulas like Candemel or Hip are really nice if they align with that family's value system. Otherwise, a lot of the standard formulas in North America, formula is very carefully regulated because babies can get very sick from it. And so if it's available, it has been approved. What I don't recommend is that people start to make their own recipes for formula, because when parents start making baby formula themselves, there's more room for error. And that's not to overly critique parents who choose to do their own formula. I understand that there's certain situations where that is the best option to feed that baby. Do I agree that it's the best choice as a first line treatment for that baby for supplementation? No, because there is that room for miscalculation. Same reason that we tend to recommend premix formula for the very early on. So the little ready-made liquid ones, I recommend to have, like, if families need to in that first week, use it. You can use powder safely if you have a safe water source from birth in a healthy term infant. But for a lot of families, having the premix early on just ensures that they don't mix it incorrectly, because we unfortunately on occasion we do see a family, but just out of fatigue, they mix formula in a way where they're putting not enough water in or too much water in. And then what can happen is essentially babies like drinking the wrong electrolyte mix. And electrolytes are incredibly important for kidney function, brain function, and those babies can get very sick, including having seizures and damage to their kidneys. So messaging ultimately on brand of formula, I don't care what brand you use, as long as it's a commercially available formula, it aligns with your value system, and your baby tolerates it well. Thanks for asking that. That's a great question. Okay. This one's funny. Weirdest thing that I've ever been asked about birth. I don't think there's ever anything that I find weird, because birth is just a bodily function. It's everybody who is here on planet Earth arrived through a birthing process, whether or not it was a vaginal birth or a C-section, everybody arrived. So I don't find anything about birth weird. I want to know what you think is weird about birth, so then I can maybe help you not find it so weird. Okay. I think we'll go for just, at what age would it be good to wear a baby? Okay, we're gonna do the last couple questions and then I'm gonna wrap it up because it's getting late. At what age would it be good to wear a baby? So, baby wearing is one of my favorite things. When I had my own baby, I absolutely loved baby wearing. It was one of the things when I was pregnant that I was so excited to do. And you can safely baby wear from birth. You just have to have the right setup. So depending on the type of carrier, check when you purchase it, or if you buy it secondhand or you're given one, the rating. So they'll most of the time have a rating about when you can safely wear. If it's a more structured carrier, many times baby needs to be 10 pounds to not use the infant insert. And the infant insert is essentially a pillow, like the brand Ergo comes with like a little pillow. And essentially what it does is it makes sure that baby's at the right height and that their legs hang. There's obviously very important ergonomics with baby wearing. So there's tons of great videos on YouTube, but some real basics are, you want baby high enough that their head is kissable. You want them facing mom. You want their head tipped up, or dad or grandma, whoever's baby wearing, head tipped up, ideally then there's the head is secure but not pushed down, and also the legs are in an M shape. So a lot of the time when I see baby wearing that looks not ergonomic, it's the legs are ween. Baby wearing. I got too excited to talk about baby wearing. But yeah, the M shape on the legs, not the W shape. Typo. So what Raccoonpedia meant to say was wean. At what age would it be good to wean a baby? So what the World Health Organization recommends, and this aligns with most government recommendations and certainly what lactation consultants such as myself believe, that babies should be, when medically possible, exclusively exclusively breastfed for the first 6 months of life. And so ideally in a situation we're avoiding non-breast milk supplementation for the first 6 months of life, and breastfeeding should continue, not exclusively. We introduce solids around 6 months of life until 2 years of age. And so when it works for a mom and it works for a baby, the World Health Organization actually recommends extended breastfeeding until at least 2 years of age. Many infants will choose to wean, or a mom will choose to wean sometime after that 6 months up until 4 or 5 years of age. And so when is the right time to wean a baby? That depends a lot on how's mom's health, how's baby's health. Is breastfeeding still working for both mom and baby? Because sometimes it's not, and we don't need to stay attached to the idea of breastfeeding when it's not working for both mom and baby. That is okay. Ultimately, we need a baby who's fed and a mom who feels like a whole person. And sometimes that's not continued breastfeeding. And sometimes the continued breastfeeding is the joy of that mom's life. And sometimes actually weaning baby is the joy of both mom and baby. So at least 6 months of age, we want to continue providing breastfeeding or breast milk, with continued breastfeeding or breast milk until 2 years of age or longer. In fact, there's always a medical benefit to breast milk. They say, what we know from the research is that even breastfeeding beyond 2 years continues to provide infants and children with the immunological benefits, the gut health benefits, and there's great studies that show improved intellectual function among children who are breastfed. So yeah, that's your answer for that one. All right, thank you for everyone thank you to everyone who tuned in. Clearly I need to go to bed. I appreciate you guys being here. I loved having this chit chat with you. I think I'll do more in the future, but I'll wrap it up here and say good night. Have a great one, everybody. We'll see you in the next one.